Hi, good evening. A very warm welcome to all of you. As you all know that we are celebrating Breastfeeding Week. So I, Rupa Soni, welcome all of you on behalf of Luthra Maternity and Infertility Center. As we talk about Luthra Maternity and Infertility Center, it is one of the
बर्तन
oldest hospitals in
ब्रेस्ट
Dehradun and it was started in 1970.
सकते
Its legacy is being beautifully carried by Dr. Aarti Luthra, who is an endoscopic surgeon and fertility specialist and is a practicing gynecologist for more than 25 years. Hello, ma'am. Welcome. She is an expertise in laparoscopic surgery, high risk obstetrics, and also does a lot of social work for women empowerment. She is a passionate promoter of anemia screening, health programs, and menstrual hygiene, and does a lot of charitable and social work to support the weaker sections in association with the Rotary. So we have with us Dr. Aarti Luthra to talk about a very, very important topic, the importance of breastfeeding. Hi, ma'am. Welcome.
Hi. Good
Nice to
evening.
have you. Good
Thank
evening.
you.
So, ma'am, it is a very important week which you have been initiating, the breastfeeding week. So, ma'am, breastfeeding is a mother's gift to herself, her baby, and the earth. So, ma'am, to start up this topic, let us start with the importance of breastfeeding. मैम आजकल मॉडर्न टाइम आ गया है, लोगों के पास मतलब मदर्स के पास भी टाइम नहीं है फीड करने का. सो दिस इज समथिंग विच इज वेरी इंपॉर्टेंट फॉर देम टू नो दैट व्हाट इज द इंपॉर्टेंस ऑफ ब्रेस्ट फीडिंग मैम.
Yes. So we are celebrating Breastfeeding Week from 1st to 7th of August. How we started celebrating Breastfeeding Week? Because maybe about 25, 30 years ago, the bottle feed got lot of popularity because mothers were working, they had lots of responsibilities, and there was a lot of publicity about the formula feed, and everyone
Yes.
thought that who gets into the hassle of breastfeeding, let's give bottle feed, it's convenient, quick, and the baby is satisfied for longer. But
Yes, ma'am.
then the health authorities started realizing that small newborn infants are falling sick more often. And you must be remembering there was a time जब डायरिया बहुत होता था बच्चों को.
Yes,
पूरे
ma'am.
पूरे वार्ड जो है ना समर्स में, they used to be full of small children having diarrhea, and newborn diarrhea से lots of kids, they used to fall very sick, and some of them, they even were not able to survive also.
Okay.
So when health authorities started introspecting कि all these kids who are born normal and who are healthy, why are they falling sick? Then the main reason which came into light was that these children were on bottle feed, they were getting infections more easily, they were getting diarrhea more easily, and that's why they were getting admitted to the hospitals. So breastfeeding, जिसे कहते हैं ना कि mother's milk is like the most precious gift which a mother can give to her
बिल्कुल मैम.
newborn. Why? Because it helps the baby to develop a bonding. And this
Yes, ma'am.
bond between the mother and the baby is very important. A baby which was in mother's womb for 9 months, and suddenly, if we start feeding with a rubber nipple, is totally criminal. So,
Yes,
the warmth of the mother helps the baby feel very secure, number one. Number two, the baby doesn't fall sick, like they don't get repeat डायरिया, रेस्पिरेटरी इन्फेक्शंस. पहले न्यूमोनियाज भी बहुत कॉमन होते थे बच्चों
yes,
में.
ma'am.
यू वुड हियर कि जी उसके बच्चे को न्यूमोनिया हो गया, एंड द बेबी इज ऑन आईवी एंटीबायोटिक्स. सो
हाँ जी.
those babies who are on exclusive breastfeed, they don't get respiratory infection, they don't get diarrhea very often. And एक और चीज जो बहुत कॉमन है, childhood obesity. People
Yes, ma'am.
realize कि जो bottle fed, formula fed, I'm not against different formula feed preparations, but I'm just enumerating like those newborns who were formula fed, उनमें obesity का incidence बहुत ज़्यादा था, because most of the children, they were gaining lot of fat, and they were gaining weight very fast, those who were on formula feed, और बाद में वो obesity की form में continue हो गया. So that way, एक और जो बहुत important चीज़ है, जैसे आजकल everyone knows about immunity, immunization.
Yes,
So
ma'am.
what we tell every woman that a child's first immunization shot is starting breast milk,
Yes, ma'am.
because it gives very good immunity to the baby. From the mother, it passes good antibodies to the baby, and these antibodies, they protect the baby against different infections. Similarly, even in COVID times, when the mother was positive but not
Yes,
unwell,
ma'am.
so we were getting lots of queries. Ki, ma'am, I have COVID, but do I feed the baby or not? So we were telling all the mothers, wear a proper mask, and you keep feeding the baby, at least pass immunity to the baby. So it has multiple advantages,
Yes,
and
ma'am.
protection of from infection and bonding are the most common ones. और क्या फायदा है? See, it is so economical.
Yes,
Like,
ma'am.
it's easily available,
Yes, ma'am.
normal temperature. And I tell all the moms, see, you don't have the hassle of getting the bottle sterilizer, the bottles, a box of formula feed, and a fancy baby bag. And if you want to go for a drive, you want to go somewhere, just carry your baby, and you have, you know adequate supply of milk for the
Yes,
baby.
ma'am.
Watch a
And
movie,
मैम
feed the
रात को भी उठ के मैम बेड से उठना नहीं पड़ेगा. It is so convenient.
रात को भी मेकिंग अ टॉप फीड इज वेरी डिफिकल्ट एंड कम्बसम,
Yes, ma'am.
नींद खुल जाती है, बट फीडिंग द बेबी मदर्स मिल्क, द बेबी ऑल्सो स्लीप्स कंफर्टेबली.
And मैम
सो
that
लॉट्स
warmth is always there. जो मदर की
या
warmth है मैम उसका तो कोई मुकाबला ही नहीं है. तो
एब्सोल्युटली.
बिल्कुल. मैम एक बात बताइए, when should a mother, जिसने अभी बेबी को who's just giving birth, when should she start feeding? मैम ब्रेस्ट फीड कब स्टार्ट करनी चाहिए? बिकॉज मैम कई बारी ऑपरेटिव केसेस में लेट होती है फीडिंग, लेडीज लेट दे पाती हैं बिकॉज कई बारी वो मैम इंजेक्शन की वजह से अंडर सेडेशन होता है. सो मैम व्हेन शुड, व्हाट इज द राइट टाइम फॉर अ मदर टू स्टार्ट ब्रेस्ट फीडिंग?
That's a very good question. Thankfully, nowadays, new mothers, modern educated mothers are so aware that they ask for it. But what we promote skin to skin contact after the delivery of the baby. So most of the times, जैसे पुराने ज़माने में होता था कि when the baby comes out, you put the baby to mother's chest only. Okay. And if the baby suckling is good, बस बेबी का थोड़ा माउथ क्लीन करके, जो नॉर्मली व्हेन द बेबीज आर born you have to suck out the secretions,
हाँ
the
जी.
baby can be allowed to suckle mother's breast within half an hour or maximum 1 hour of childbirth. Even for cesarean patients, the ideal practice is what we do. Once the baby is delivered, the baby is on the mother's chest, okay, and then the pediatrician cleans the throat and everything, and till the time we are finishing the thing, for cesarean or normal delivery, the baby is put to mother's milk only, and most of them, they start suckling so well because their
Okay.
mind registers that this is my first feed. So it's such
Yeah.
a beautiful reflex,
Yes, ma'am.
that, you know, number one, the mother gets to feel the baby's touch,
Yes,
and
ma'am.
and then if the baby is put to mother's breast, the baby gets the first lesson that this is
Yes.
my food. I have to start suckling. And
Thank-
most of the
Yes.
healthy babies, they suckle so well that maybe 80% of the mothers, they don't start bottle at all. If they, especially
Okay.
second baby, may the mother gets lot of milk
हाँ जी.
from day one. So they don't want to buy a bottle or a box of formula
Yes, ma'am.
feed. Yeah. In
Yeah, ma'am,
fact,
it's
mother,
always better. हम लोगों ने भी मैम 2-2 साल फीड किया अपने बच्चों को. 1.5 year तो मैम किया ही है. तो
that's very good. And if you are going to set an example, like, we all should set an example for our youngsters, for our
yes,
friends,
ma'am.
that they should promote it, because बच्चे का IQ development बहुत अच्छा होता है.
हाँ जी
And
मैम.
what I personally feel, there is something like EQ. EQ. We all talk about emotional quotient. So
Yes, ma'am.
all those babies who are breastfed, you know, their temperament is better. They
हाँ जी.
cry less. They sleep better. And mother के लिए तो the best benefit is, when you're feeding your baby, you're passing your extra calories.
Yes, ma'am.
So mother gets back to the shape very quickly.
Yes,
At
yes.
the same time, um, जो मदर्स को आफ्टर चाइल्ड बर्थ थोड़ी ब्लीडिंग होती है, बिकॉज द यूट्रस कम्स बैक टू नॉर्मल साइज क्विकली, दैट ब्लीडिंग इज ऑल्सो लेस.
Okay.
And one big advantage is, thankfully, इंडिया में ऐसा नहीं होता है, but in Western countries, postpartum blues are very common.
अच्छा.
And yeah, postpartum blues means कि after childbirth, the mother suddenly starts feeling so low because she has so many responsibilities,
Yes.
and postpartum depression, postpartum blues. But in our country, a lady who delivers a baby is pampered by mom, mother-in-law,
Yes, ma'am.
sister-in-law, friends, and everyone is there to offer help.
Help.
And this
Yes, ma'am.
help and support, is the main reason that women in India are happy after childbirth, and they get to eat lot of,
Yes, ma'am.
yummy things also. And Western countries, the support groups are not there. The family support is not so big. So over there, the mothers have a tough time.
Yes, ma'am.
But all this support helps the mother to recover faster, and they get back to shape faster also.
Yes, ma'am.
Because if you're not taking a lot of extra calories, and if you're feeding your baby, you'll get back to shape. और एक जो सबसे important होता है, like, you must be reading, the incidence of breast cancer is also increasing nowadays.
Yes, ma'am.
So those mothers who breastfeed their babies, the risk of having breast cancer is also less. So that's
Yes.
why you have said, if you feed the baby till 2 years of age, it's very good for the mother's health, and it reduces the risk of ovarian cancer also.
Yes, ma'am.
एक और चीज जो पहले बड़ी कॉमन होती थी, till the time you're feeding the baby, your chances of getting pregnant are less.
Yes, ma'am. हाँ जी,
So it
बिल्कुल.
gives you a contraceptive effect also, although that's not a very effective method, like it's only 80-85% effective,
Okay.
but it protects the new mother against pregnancy.
Yes, ma'am.
Yes.
सो मैम एक बात बताइए, नॉर्मली इट इज सेड कि जैसे ही बेबी ब्रेस्ट फीड करते हैं हम लोग, सो मैम कोलेस्ट्रॉल जो आता है फर्स्ट येलो मिल्क आई थिंक, सो मैम उसके बारे में प्लीज बताइए एंड इट्स इम्पोर्टेंस मैम, बिकॉज दैट इज द फर्स्ट मिल्क विच वी गिव टू द बेबी
Hmm.
while we feed
So
first.
colostrum is the first milk which is little thicker, which is very rich in immunoglobulins. Immunoglobulins means jo, these are the substances which give immunity to the baby. जैसे मैंने पहले बोला कि first immunization. So
Yes, ma'am.
colostrum is very rich in immunoglobulins and antibodies which come from the mother to the baby, and it protects the baby against different infections in intestines also. Like कई बार ना preterm babies होते हैं, the baby comes out early and
हाँ
they
जी.
come at 8 months, and they are not able to take proper mother's feed. But even in these babies, the pediatrician makes sure that we give colostrum to the baby, because उससे बच्चों में there is one dreadful disease, NEC, necrotizing enterocolitis. मतलब कि because the baby is preterm, the baby's lungs are sensitive, the baby's intestines are sensitive, so they are at risk of getting infection in the intestine. But the risk of NEC is very less in preemies who are given colostrum.
Okay.
So it's another precious gift from the
मैम
mother.
मैम ये जो आता है ये मैम इट इज इमीडिएटली आफ्टर यू डिलीवर, तो मैम दैट फर्स्ट फीड में ही ये इट कम्स. तो
Yeah, first few days, you know what, like I said, the first baby when it comes, like if a mother is delivering for the first time, some of them may have very good milk, but some of them may have less amount of milk. So uske liye we educate the mother that we initiate feeding early, like within 1 hour of birth we should initiate feeding, and then we should be putting the baby to the mother's breast every 2 hours. And when the baby suckles the breast, our brain gets the stimulation, and there are two hormones, prolactin and oxytocin. They are released when the baby suckles the breast. They
yes,
go and tell our brain, see, there is demand for milk. And then the mother starts forming milk. And within 24 hours, if the baby is suckling repeatedly, and इसमें ना main support चाहिए, because see, if a lady has delivered normal, she is exhausted.
Yes, ma'am.
If she has delivered by cesarean, again she is scared कि अगर मैं move करूँगी तो my stitches should be fine.
बिल्कुल. हाँ जी, मैम.
So both kinds of deliveries, the mother has to be motivated and supported by the doctors, by the health workers, and by family. That we have to start introducing milk to the baby so that the baby also gets a taste of the milk. Otherwise, the formula feeds, they have a different taste. Like
Yes, ma'am.
they are very tasty, and the
हाँ जी.
mother's milk is little salty and not so tasty. So
Yes,
we
ma'am.
have to tell the baby that he has to get used to taking mother's milk. That's very, very important.
मैम क्योंकि फॉर्मूला मिल्क से मैम एक और चीज है, कई बार बच्चे बहुत कॉन्स्टिपेटेड हो जाते हैं मैम, क्योंकि
Very right.
एंड मैम देन उनके स्टूल इतना हार्ड होता है एंड इट्स वेरी डिफिकल्ट एंड फॉर अ स्मॉल बेबी हु इज जस्ट बॉर्न और अ फ्यू डेज, तो उसके लिए वो रिफ्लेक्स भी बहुत टफ हो जाता है मैम, बिकॉज बच्चा तो इतना छोटा सा जानी कितनी है अभी छोटा सा तो.
You are a very intelligent person. Actually, this is another advantage जिसको कहते हैं ना colicky baby. You know, the infant colics are less. If the mother is breastfed, तो normally आपने देखा होगा the family is running to the doctor. बहुत दर्द है पेट में, बहुत दर्द है.
Colic.
So colics are less if the baby is breastfed, and of
Yes,
course the chances of constipation are also less. In fact, we tell all our mothers that even if the baby passes stools after taking feed every time, it is normal because the kids have a reflex, gastrocolic reflex. So whenever they'll get some feed, they may pass small amount of stool. That is normal. But of course, constipation can really trouble a newborn baby.
yes,
That's a
छोटा सा
very
बच्चा ही तो है.
yes.
बिल्कुल.
Sure.
मैम एक बात बताइए, हाउ लॉन्ग शुड वी ब्रेस्ट फीड मैम? मैम क्योंकि आजकल 90% वुमेन दे हैव स्टार्टेड वर्किंग, सभी वुमेन
Yeah.
वर्किंग भी हैं, सो मैम कितना मिनिमम टाइम है कि एक मदर को ब्रेस्ट फीड करना ही चाहिए मैम? हाउ लॉन्ग, और कितना लंबा टाइम हो सकता है मैम जब वो करे मैम, जितना वो दे सकती है मैम?
This is where motivation works. And I'm so happy to see my most modern girls. They are very keen to feed the baby. I don't
Yes,
want
ma'am.
to name them, but all those well educated techie girls, they are very clear, like the care of nipple before delivery, and then they want to start feeding within 1 hour. And the recommendation is that first 6 months should be exclusive breastfeeding.
Yes.
Exclusive breastfeeding में ना, जो ओल्डन टाइम्स में होता था कि बच्चे को हनी देना है, ग्राइप वाटर देना है, बॉनीसन देना है, nothing should be given because that can cause infection. And another very important thing, lot of families they want कि हम काउज मिल्क दे देते हैं बेबी को.
Yes. हाँ जी.
और बहुत इंटरेस्टिंग क्या होता है, बफेलोज मिल्क दे देते हैं पानी डाल के.
पानी डाल के मैम, बिल्कुल ठीक है.
Because buffalo's milk is pretty heavy.
Heavy,
So they
yes.
ask कि सब इसमें आधा पानी डाल के पिलाते हैं. They have to be explained that cow's milk and buffalo's milk can never come anyways near mother's milk.
Mother's milk.
So we should never try to feed cow's milk or buffalo's milk to the baby, and the mother should be really motivated to give exclusive breastfeed and nothing else for first 6 months, and then gradually we can start introducing semi solids. And the recommendation is the mother can feed till 2 years, but depending upon the circumstances and work pattern. But I would like to share one thing, like few of my doctor friends only in their family, the new mothers, the young mothers, they start storing the breast milk.
हाँ जी मैम.
Like you get nice containers, you write a date for the extra breast milk which is being formed, and you put it in the freezer. Okay. And when the mother goes for work, this milk can be utilized by the family members, or like there are nannies in US. So they take out the milk and then they thaw it. Thaw it means कि उसको normal temperature पर लाकर they use it for the baby. And breast milk storage जैसे होता है ना, हम बाकी चीजें अपने फ्रीजर में स्टोर करते हैं. So mothers are storing breast milk date wise. And date wise क्या होता है, the milk which is stored first will be used first when the mother joins back work.
हाँ
एंड
जी,
एक बार लेकिन उसको अगर हम थॉ कर लेते हैं, लाइक फ्रीजर से निकाल के बाहर रख लेते हैं, देन इट शुड बी यूज्ड विद इन 2-3 आवर्स. उसको दोबारा नहीं रखते. सो व्हाट दे डू, स्मॉल स्मॉल बॉटल्स, यू गेट देम इजीली, उसमें कंटेन करके हर बार के लिए 30-40 ml मिल्क, और for a bigger baby maybe 60 ml, they
हाँ जी.
store them and then they keep taking it out, जैसे आप अपने रेफ्रिजरेटर से बाकी चीजें निकालते हो, and they give it to the baby and try to continue giving breast milk to the baby till 2 years if possible.
बिल्कुल मैम. ठीक है. और मैम एक बात बताइए, जो ब्रेस्ट फीडिंग मदर्स हैं, नॉर्मली तो मैम उनको कहा जाता है कि तुम यू आर फीडिंग तो तुम खूब दूध पियो. मैम एक टेंडेंसी होती है कि सारा दिन जो बड़े हैं हमारे घर के या जो है वो दूध बहुत पिलाते हैं कि तुमने दूध, बिकॉज यू हैव टू फीड द बेबी, तो तुम दूध पीना शुरू कर दो. सो मैम एक तो ये बताइए कि इज रियली मिल्क दैट इम्पोर्टेंट, और व्हाट न्यूट्रिशन मैम जो देना चाहिए फॉर अ मदर हु इज लैक्टेटिंग.
That's very true. There are lots of myths and food fads. सबसे important milk वाला है. Of course, you need extra calcium because you are passing on your calcium stock to the baby.
हाँ जी.
So to get extra calcium, 1 liter of milk in any form is good. And then we want the mother to take calcium supplements and vitamin D3 supplements also. But
हाँ जी.
at the same time, mother needs very good diet which is very rich in proteins and all other nutrients, so that she gets those extra 500 kilocalories to pass on to the baby. Because if the mother's nutrition is good, the quality of breast milk will be good. And there's another food fad: if you're feeding the baby, you cannot eat heavy food. Most of
हाँ
the
जी मैम.
times, you have to understand that breast milk जो है, it is a secretion from our blood only, and it does not carry the food directly which the mother eats. Like if the mother is eating mangoes, the baby is not getting the flavor of mangoes. The flavor of the milk is same. That's
Same.
why there is concept of the way there are blood banks, no, ऐसे breast milk banks भी होते हैं. Even in India there are breast milk banks in Udaipur, Bangalore, Mumbai, because you must have read, it was in the news that one mother had COVID and she was really unwell, and she delivered a baby at 8 months. So, because the mother was hospitalized and the baby needed breast milk, so the other women in the ward, they gave their breast milk to the baby so that the
Wow.
baby remains healthy. And this was in the front page of TOI last month.
Wow,
And this
ma'am. So
thrived
beautiful.
so well. And when the mother recovered after 3 weeks from very severe COVID, she could start continuing breastfeeding to the baby.
Wow.
So breast milk can be shared also. And
How sweet.
yeah, because जैसे हम blood कहते हैं ना, if someone has short, very low hemoglobin, so we suggest, oh, we'll give a blood transfusion. So if the mother is not getting enough milk, the baby can get milk from another mother also, because the quality, if the mother is healthy, like the mother should not be having severe diseases like HIV and all, which are being screened everywhere for all pregnant women.
हाँ
If
जी.
the mother is healthy, the milk can be given by the mother also. And regarding the the supply of dry fruits which is given after
हाँ जी.
childbirth,
पंजीरी.
in moderate amount it is nice, because all nuts have DHA.
Yes,
DHA
ma'am.
is very good for brain development.
हाँ
So
जी मैम.
a moderate amount of nuts, moderate amount of good diet is good. And some of the old practices, like the jeera water
Yes,
and
ma'am.
putting a tadka of jeera, they are
मैम
all
घी.
as या galactocoke, मतलब कि वो थोड़ा मिल्क प्रोडक्शन बढ़ाते हैं. And what I feel, if you pamper a lady, otherwise also she'll have good amount of milk and she'll
Yes, ma'am.
enjoy feeding the baby.
मैम
Yeah,
हैप्पीनेस से भी आता है मैम, जब हम बहुत खुश होते हैं ना,
absolutely.
तो मैम
Yes. हाँ.
तो
So the
आता है.
mother has to be relaxed and happy. Yes.
यस मैम. तो मैम इतना अच्छा बच्चा हमने, वी गिवन बर्थ टू सच अ ब्यूटीफुल चाइल्ड, तो मैम अंदर से खुशी होनी चाहिए. सो
Hmm.
तो आधा तो
And the
पर्पस
mother
वहीं सॉल्व हो
needs
जाता
good
है.
rest also. Mother needs good rest, because if the mother is not able to get proper sleep, again she's irritable, and she's not in a good state to feed the baby. So the mother needs lot of care and support from everyone around,
हाँ जी
especially
मैम.
the husband. Yeah.
या मैम एक बात बताइए, कोविड के टाइम में मैम जैसे अब कोविड आ रहा है एंड पीपल आर गेटिंग वैक्सीनेटेड एंड मैम बट दे आर वुमेन मैम हु आर एक्सपेक्टिंग और या जिनके बेबीज हो गए हैं. सो मैम मैम वैक्सीनेशन के बारे में एंड वैक्सीनेशन एंड लैक्टेशन का मैम इसके बारे में भी थोड़ा क्लियर कर दीजिए बिकॉज पीपल हैव अ लिटिल एप्रीहेंशन ऑन दिस आल्सो.
Yeah. So, COVID vaccination is recommended for all lactating mothers. Till a month ago, the government had given guidelines that vaccination can be given to lactating women and not to pregnant women. At that time, the day the lady was delivering, we were telling them that within a week, you please get yourself vaccinated for COVID, because uh, you'll be passing antibodies to the baby, and the baby will be getting immunity also. And now all pregnant women are getting vaccination for COVID, and a lot of them have got 2 doses also. So we should not feel scared, because it's very important to save our pregnant women. And the second wave
Yes,
was very bad for a lot of pregnant women. It
yes मैम.
affected badly their health, and some of them they lost their lives also.
Yes
So
मैम.
vaccination during pregnancy and in lactating women, no one should hesitate, and everyone should be going for it as early as possible.
यस मैम. मैम इसमें तो बहुत सारे मिथ्स थे मैम वैक्सीनेशन के कि पीरियड्स आ रहे हैं तो वैक्सीनेशन मत लगवाओ, ये मत करो. सो
No, it's very funny, but there is no scientific reason behind not getting the vaccine during periods. Only if someone has fever or someone is unwell, that person should avoid getting the vaccine.
यस मैम. मैम एक बात बताइए, कौन से फूड है मैम स्पेसिफिकली विच फूड आर इम्पोर्टेंट फॉर लैक्टेटिंग मदर्स. मैम जैसे जीरा और घी तो हमें मालूम है, बट मैम व्हाट इम्पोर्टेंट फूड्स फॉर लैक्टेटिंग मदर्स को उनको क्या लेना चाहिए ताकि जो वो इम्पार्ट कर रहे हैं खाने के थ्रू अपने बच्चे को, दैट शुड बी वेरी गुड एंड न्यूट्रिशियस मैम, टू बी वेरी
Bas- Yeah, there is no specific food which increases milk production, but if the mother is relaxed, she's getting nutritious food which has lot of proteins, milk, and carbohydrates for energy, moderate amount of fat. ये जो मिथ है कि बहुत सारा घी और गुड़
yes मैम.
खाने से मिल्क ज्यादा होगा, लाइक मॉडरेट अमाउंट ऑफ फैट, जो पुराने जमाने में गुड़ देते थे, that's a good source of iron, plus it
Yes मैम.
gives energy also, but everything in moderate amount, it's good for health. और बहुत ज्यादा excess से क्या होगा, even the mother who has delivered a baby, she'll gain 20 pounds more, है ना. And then the mother gets frustrated that why am I looking so fat.
Sluggish.
Yeah, they don't realize that they have been fed the wrong kind of diet. So if a lady is careful about the diet after delivering a baby, like she doesn't take too many extra calories, only 500 kilocalories extra are good enough for feeding a baby. And if she's active, like she does her routine work, she's walking all around, she's taking lots of fluids, most of the times, the lady gets back to shape and normal activity very soon. In fact, lot of times within 10 days of childbirth, when the mother walks in, it's so difficult to identify कि अभी baby हुआ है, because they are so careful about everything. So
मैम मुझे ऐसे लगता है कि फर्स्ट बेबी में तो चाहे थोड़ा सा ना गर्ल वांट्स टू बी पैम्पर्ड आल्सो, तो वो थोड़ा सा ध्यान से करती है हर चीज. मैम सेकंड टाइम जब सेकंड बेबीज होते हैं ना तो फर्स्ट वाले का भी ध्यान होता है बच्चे का, तो यू आर ऑन योर टोज बहुत जल्दी.
more confident, they're more confident.
Yes
Yes,
मैम.
you're right.
And then मैम वो just to balance between both the kids also, I think mothers get on to their work and everything very fast.
Yeah.
मैम एक बहुत इम्पोर्टेंट था क्वेश्चन मेरे माइंड में आ रहा था कि मैम जब हम फीड कर रहे हैं विद ऑपरेटिव और नॉर्मल डिलीवरी, मैम हाउ फास्ट कैन अ वुमेन गो बैक टू एक्सरसाइज मैम, दो इट इज योगा और एनी अदर एक्सरसाइज, हाउ फास्ट मैम कितनी जल्दी वो करना शुरू कर सकती है, मे बी एट होम ओनली, बट स्पेशली आई थिंक योगा हेल्प्स अ लॉट
Yeah.
टू रिकवर ऑल्सो.
After childbirth, most of the times the mother doesn't get time, but we promote all mothers that Normal delivery, they start walking within 3 4 hours after delivering the baby. C-section, after 48 hours, the mother is allowed to move around. They
हाँ जी.
should start walking. They should start doing breathing exercises and little bit of stretching exercises after a week or 10 days should be started. The only thing they have to keep in mind is that the uterus takes about 6 weeks to come back to its normal size. We call it involution of uterus. So till the time involution is not complete, they should not be doing weight bearing exercises.
Yes, ma'am.
But if they want to do, it depends, what that lady was doing pre delivery. So if someone had a good stamina, she was walking for about 7 to 8 kilometers. So again, she can get back to 5 kilometers per day. And it depends, like if she was doing treadmill at the rate of 8 kilometers per minute, thoda come 5 6 kilometers per minute. So whatever you were doing pre-pregnancy, little less than that, that can be resumed after delivering a baby whenever you have, energy and time, because I feel a newborn baby needs all the time from the mother.
Yes,
Yeah.
ma'am. Yeah,
And the
true,
mother
ma'am.
needs a good sleep also,
हाँ
but
जी.
she should do interesting exercises so that she feels good about herself. And
Yeah.
breathing exercises are very good.
हाँ जी मैम, बिल्कुल.
Yeah.
इनफैक्ट आई वुड से मैम कि थोड़ा सा किसी के अंडर ही करें, चाहे प्री प्रेगनेंसी, पोस्ट प्रेगनेंसी, बाद में भी, बट अंडर सम गाइडेंस, बिकॉज टू बी ऑन द सेफर साइड you should be always under the guidance of a guru, teacher, so whosoever you are under, doing exercises under someone. So that is important. मैम, ह्यूमन मिल्क बैंकिंग के बारे में आपने अभी बात करी थी, तो मैम इसके बारे में थोड़ा बताइए, क्योंकि इट्स अ वेरी न्यू कॉन्सेप्ट. आई थिंक कुछ साल पहले तक तो ये नहीं था मैम, वी हैड नॉट हर्ड अबाउट इट. तो मैम
Yeah.
इसके बारे में प्लीज थोड़ा सा अवेयर करिए हम सबको.
Because we all are seeing that how important breast milk is for good health and immunity of the baby. So the pediatricians, they came up with the concept of human milk banking. And it is an effort to have a human milk bank in every city, where lactating mothers can store their milk, and if it is extra, they give a consent that it can be utilized by for other babies, where the mothers are not in a condition to produce enough milk. Maybe the mother is sick or for some other reason, and this milk can be used so that the baby is not deprived of the benefits of breast milk.
Breast milk.
you know so they get better immunity and better protection against diseases also.
सो मैम इट्स अ वेरी ब्यूटीफुल थिंग मैम. अभी तक तो हमने यही सुना था कि मैम
अपनी
एग्स मिल रहे हैं.
आई नो एग्स मिल रहे हैं, ब्लड मिल रहा है. या
हाँ,
सो
बट
द
मैम ये
मिल्क.
बहुत ब्यूटीफुल है. स्पेशली मैम कई बच्चों की मदर्स दे पास अवे ऑन गिविंग बर्थ आल्सो, या एज यू सेड दैट मदर्स आर नॉट वेल. सो मैम एटलीस्ट द चिल्ड्रन विल नॉट बी डिप्राइव्ड ऑफ सो कॉल्ड मदर्स मिल्क, एंड they'll come out to be healthy children. मैम एक बात बताइए, कुछ बच्चों के जैसे अभी वी वर टॉकिंग, मदर्स नहीं दे पाती मिल्क, मे बी दे आर नॉट वेल. मैम क्या, मैम व्हाट इज द डिफरेंस, what difference do you see as a doctor in children who are breastfed and who are very nicely nurtured with their mother? कई mothers की कुछ मजबूरी है मैम, कई बारी हेल्थ इश्यूज ही होते हैं ऐसे कि मदर कैन नॉट ब्रेस्ट फीड. तो मैम व्हाट इज, मैम क्या डिफरेंस आपको लगता है इसमें, क्या होता है बच्चों में, क्या डिफरेंस दिखता है सबसे ज्यादा?
To be very frank, the mother feels more frustrated, and lot of times,
हाँ.
initially, if the mother has not really tried her best to feed the baby, they'll come back to the doctor after 2 3 months. Now I want to start feeding the baby, and sometimes if there is some milk, and if they give the milk regularly, it comes. And regarding babies who are not breastfed, you know. They grow well because there are other ways to pass the affection and bond also, if the mother is not able to feed. But of course, it's always preferable to give breast milk, If not possible, if the baby is not able to get milk from the human milk bank, then of course the baby is getting enough immunization from the pediatrician. And then we have to be very careful about bottle hygiene also, and
Yes, ma'am.
that the brand of milk. And normally till 6 months, cow's milk or buffalo's milk is to be avoided, because science says that the composition is too heavy, and sometimes
Yes,
it is not well digested and tolerated by the baby's
yes, ma'am.
kidneys also. So there is a good question by Avantika.
Yes, ma'am.
He wants to
How
know how.
important is oil massage after delivery, and does it increase milk production?
See, what Rupa had said, exercise. Oil massage does the same thing. If we are allowing the mother to move around, to do exercise, the circulation is good. Oil massage, what I consider, is a pampering which you can indulge into. The way you go to different massage places. And if the mother is not doing anything, like in India, the mother is not supposed to work after delivery,
Yes,
they
ma'am.
get a nice break from the kitchen, then you indulge into all these luxuries. And regarding the effect of oil massage on lactation, if the mother is feeling good, be it oil massage, be it good food, or be it any kind of support, the production of milk will be good, because the mother is getting rest while getting massage. So, in a way, it makes the mother feel good and important. So, that may help in better production of milk. But I doubt that other countries like London and USA, massage is quite popular. It's more popular towards our side of globe
Yes,
only.
ma'am.
Yeah.
मैम एक बात बताओ, नॉर्मली जब जैसे हमारा बेबी होते हैं, व्हेन वी डिलीवर आवर बेबी, सो बड़ा लाइट फूड, जैसे मैम मूंग की दाल में घी डालकर छौंक देते हैं, उस टाइप की लाइट ही दिया जाता है, सो दैट इट्स इजी डाइजेस्टेड मैम। और पर मदर को मैम क्या होता है, क्रेविंग्स बहुत होती है मैम, किसी को चाइनीज खाने की क्रेविंग हो रही है या कुछ और, तो मैम किस हद तक खाना चाहिए मैम, क्योंकि एज यू अभी यू सेड कि मैम वो डायरेक्टली, कई लोगों को लगता है कि व्हाट वी आर हैविंग डायरेक्टली गोज टू द चाइल्ड। Ma'am, there's a question before you. I feed for 3 years and Aarti ma'am encouraged me. It is too good and the best doctor. Oh, ma'am,
Thank
Neha
you.
Negi is saying this.
Thank you,
She must
Neha.
be a
Thank you.
patient.
Thanks. I hope
So,
you'll encourage your friends also, my dear. Very
ma'am,
nice. Yeah.
तो मैम अब आप बताइए, खाने का बताइए। आई वाज टॉकिंग कि मैम अगर थोड़ा हेवी इंडल्जेंस हो तो मैम डज इट रियली इफेक्ट, क्योंकि मैम वो फ्लैक्चुएंस हो जाता है, बच्चों को कॉलिक हो जाता है, व्हाट दे नॉर्मली से।
Normally, if you talk practically, what the mother eats should be healthy, and if the mother is digesting it well, the baby does not get any problem. So I allow my delivered mothers to eat everything, because I ate everything when I had my babies, and
Yes,
touch wood, babies didn't have colics. But of
yes,
course, like we are not pregnant, but we will not indulge into very heavy food every day. So
yes,
in
ma'am.
moderation, everything is allowed. The mother can have little bit of pizza, little bit of good
Yes, ma'am.
thing, so that she's not gaining extra weight also, and she's not having a bad tummy also. But
Yes, ma'am.
most of the times, like, there are myths कि अगर mother को fever हो गया या mother को diarrhea हो गया, or if the mother is having cold, then the breast milk should not be given. That's wrong. If the mother is having mild illness of common kind, she should keep feeding the baby, and she should not withhold feeding her baby.
यस
Yeah.
मैम। और मैम एक बात और आई थी मैम, कई बच्चों को लैक्टोज इंटॉलरेंस हो जाता है, व्हाट दे
Yeah.
आर सेड, तो मैम उस टाइम मैम ब्रेस्ट फीड करते रहना चाहिए, बिकॉज लैक्टोज इंटॉलरेंस नॉर्मली इट इज रिलेटेड टू मिल्क।
See, if the pediatrician feels that the child is lactose intolerant and is having very bad diarrhea
हाँ जी।
when the baby is getting breast milk, then they recommend that the baby should be on lactose free milk. Lot of times it's transient only, that for a while the pediatrician would stop breast milk, and then they'll again introduce and see if the baby is tolerating the milk. So if they are proven lactose intolerant, uh, then we have to give them lactose free formula only. Yeah.
यस मैम। आई थिंक मैम हमने ब्रेस्ट फीडिंग को लेके काफी क्वेश्चंस कवर कर लिए हैं.
Yes,
एनी अदर
yeah.
क्वेश्चन एनीवन हैज, सो प्लीज कम अप. और कुछ रह गए तो वी विल गेट बैक टू यू. So Aarti ma'am, आप on this breastfeeding week, what message would you give from your being a gynecologist? So your message to everyone out there, ma'am.
As Neha had said, after childbirth, when I go to meet my patients, I really motivate them. And,
Yes,
there are
ma'am.
a lot
I
of
know
things.
that.
A good position is important while feeding, because most of the times the mother, those typical positions ki aap kahin bhi baith gaye and you start feeding your baby and the mother gets a bad backache
Yes,
and the
ma'am.
mother's posture is also getting bad. So there is lot of science in feeding also. The mother should be, while they are about to deliver the baby, they need to be promoted for they need to be encouraged for feeding their babies when the baby arrives. They need to be taught about nipple care. And then when
Yes,
the
ma'am.
baby arrives, yeah, nipple care is very important, because sometimes they have some common problems like flat nipple, inverted nipple, which
Yes,
may
ma'am.
not let the feeding occur properly. So they need to take care of that. And when the baby comes, early initiation is most important. Like the baby should be put to breast within 1 hour of birth, and then frequent feedings, and it's all demand and supply. The more the baby suckles, the more formation occurs. So another important thing is the family has to be very, very supportive, like in holding the baby, in making a position, and in looking after the baby later on, giving a burp to the baby after feeding the
Yes, ma'am.
baby.
Very
So
important.
there are 100 things, which a small baby, a newborn baby demands. And
Yes,
of
ma'am.
course, then the mother should, a working mother, otherwise government offices are giving 6 months leave nowadays. So they are all privileged. Once they are on official leave, even the working mothers can feed the babies till 6 months, and then later on they should try to store their milk in freezer, and the baby should be tried to be given breast milk for first 2 years. And there was a surge जब बीच में ना bottle feed was very common, but
Yes, ma'am.
babies were getting unwell. Otherwise, our grandmoms and our mothers, if you hear, we were all fed till 2 years. So
Yes,
we
ma'am.
are back to old practices now.
Yes, ma'am. Back to the basics, ma'am.
Back to eating bajra. We are
Yes.
back to breastfeed, and we are back to yoga. So
Yes, ma'am.
in a lot of ways, old is gold, and we should stick to good practices and enjoy childbirth, and we should try to give a lot of love and care to the newborn.
Yes, ma'am. मैम एक और चीज मेरे माइंड में आई थी विच इज आई थिंक वेरी इंपॉर्टेंट. आपने भी मेंशन किया बर्प देना बच्चे को. मैम
Hmm.
नॉर्मली ना कई बार बच्चे बहुत देर तक बर्प भी नहीं लेते, हम लोग पीछे से पैट करते रहते हैं. एंड मदर्स बीइंग टायर्ड आल्सो दे लूज देयर पेशेंस और उसको लेटा देते हैं कि तुम लेट जाओ. बट मैम क्या होता है, बच्चा सारा दूध बाहर निकाल देता है फिर मैम. एंड मैम
Yeah.
इट कैन रिजल्ट टू मेनी अदर प्रॉब्लम्स आल्सो विद द चाइल्ड. मैम इस पे
Yeah.
प्लीज थोड़ी सी लाइट डालिएगा.
So all babies, they don't burp, but I think if the baby is kept vertically for a while, the baby digests the milk. And lot of times, जो babies vomit करते हैं ना, sometimes it's overfeeding, because everyone is so enthusiastic in feeding the baby, and an overfed baby, आप जैसे ही लिटाओगे, the babies are very intelligent, and they know how much they need, isn't it?
बिल्कुल.
So the important trick is कि अगर हम baby को लिटाते हैं, the head has to be slightly raised and the baby has to be little lateral. Lateral मतलब साइड से लिटाने से क्या होता है, if the baby vomits, it does not go back to the baby's
Yes, ma'am.
respiratory system,
Yes,
because
ma'am.
उसको कहते हैं aspiration of milk, and
Yes, ma'am.
aspiration of milk can be very risky for the baby, because
Yes,
अगर baby के lungs में चला जाता है, it can make the baby very sick. So this is a very important point, burping the baby and making the baby lie slightly on the lateral side, so that if the baby is vomiting, it does not go back to its respiratory system. Yeah,
yes,
that
ma'am.
has to be done.
Yes.
Great. Yeah, you have revised all your old memories. Yeah, very quickly.
Yes, ma'am.
Thank you.
Ma'am, ma'am, these are one beautiful memories of being a mother, ma'am. And I
I
think every lady should enjoy motherhood, ma'am. We are
yes.
blessed to be mothers, ma'am. And
Hmm.
भगवान ने हमें इतनी beautiful, we are blessed to have that we can bear babies, ma'am, and then look after them, ma'am. And
I
it's a
think it
pride
is
to
the
be a
most,
mother, ma'am. Always a pride.
yeah, very
Yes,
true.
ma'am.
And it is the most wonderful experience for a lady, you know,
Yes, ma'am.
being a
Uh,
mother, taking care of
yes,
the
ma'am.
baby. Yes.
Most selfless and most emotional experience of a lady's life, ma'am. I think being a
Yeah,
mother. So,
true.
ma'am, मैं तो यही कहूँगी we should all enjoy our family, our kids. They are the most precious for us, and stay happy.
Absolutely. And COVID has taught this to everyone, even to the kids who have not gone out for maybe 1.5, 2 years, and they've
Yes,
been
ma'am.
enjoying mothers, good, delicious food. So,
Yes, ma'am.
uh,
सबके वेट बढ़ गए मैम, but कोई बात नहीं. Chalo.
great,
Thank
great.
you so much, ma'am. Thank you for sparing your time. It was an awesome session, and it we have relived our old memories also by talking about it. And
Yeah.
all the mothers, have lovely time with your babies. That's it.
Thanks. It was nice chatting, and I enjoyed your very practical questions, which everyone has. And
Thank you
it's
so much,
always
ma'am.
fun to share, thoughts with you. Thank you.
Thank you, ma'am. It's a pleasure, ma'am. Always a pleasure. Thank you. Thank you.
Okay.
Right.
Bye bye. Thank you.